Hey friends, today we're talking about a sneaky enemy of our vision, glaucoma. If you want to keep your eyes healthy for years to come, make sure to watch this video till the end. And don't forget to subscribe to the channel and hit that like button. This way you won't miss other important tips on protecting your health. Before we dive deep into the topic, let's understand what glaucoma is. It's a group of eye diseases that damage the optic nerve, the most crucial part of our vision organ. Imagine the optic nerve as a cable transmitting images from the eye to the brain. If this cable gets damaged, the picture becomes blurry or disappears altogether. That's why it's so important to protect our eyes from glaucoma. Glaucoma often develops unnoticed. Many people don't suspect its presence until significant vision loss occurs. That's why knowing the risk factors and having regular checkups with an ophthalmologist are your main allies in fighting this disease. Now, let's break down the 10 key risk factors for glaucoma. Age. After 60, the risk of glaucoma increases significantly. Why? As we age, our eyes change and intraocular pressure can rise. But this doesn't mean young people are completely safe. Glaucoma can develop in them too, just less frequently. Family history. If your parents or siblings had glaucoma, your risk is 10 times higher. Genetics plays a big role. But don't panic if you have such a heredity. It's just a reason to be more attentive to your vision and have regular checkups. Elevated intraocular pressure. Imagine your eye is a balloon. If the pressure inside is too high, it can get damaged. The same happens with your optic nerve in glaucoma. Normal intraocular pressure is usually between 10 to 21 mm/gram. If it's higher, it's a cause for concern. Race. Studies show that people of African descent have a higher risk of developing glaucoma. If this applies to you, be especially attentive to your eye health. By the way, people of Asian descent are more likely to have a special type of glaucoma, angle closure glaucoma. Myopia or hyperopia. The shape of your eyeball can affect your risk of glaucoma. Interesting, right? With myopia, the eyeball is elongated, which can increase the load on the optic nerve. With hyperopia, on the contrary, the eyeball is shorter, which can make it difficult for intraocular fluid to drain. Eye injuries. Even a minor injury can disrupt fluid circulation in the eye and increase the risk of glaucoma. This could be a ball hit during a game or a foreign body getting into the eye. That's why it's so important to wear protective glasses when working with tools or during active sports. Systemic diseases, diabetes, hypertension, and other diseases can affect the health of your eyes. Take care not only of your eyes, but of your whole body. With diabetes, for example, small blood vessels are damaged, including those in the eyes, which can lead to glaucoma. Hypertension can also damage blood vessels in the eyes. Long-term use of corticosteroids. These medications can increase intraocular pressure. Always consult your doctor about side effects. Corticosteroids are often prescribed for allergies, asthma, and some autoimmune diseases. If you're taking these drugs, be sure to have your vision checked regularly. Eye anatomy. Some people are born with eye structures that increase the risk of glaucoma. Nature sometimes plays strange games with us. For example, a narrow angle of the anterior chamber of the eye can make it difficult for intraocular fluid to drain, increasing the risk of angle closure glaucoma. Cardiovascular diseases, heart and blood vessel problems can affect blood supply to the eyes. Another reason to monitor the health of your entire body. Atherosclerosis, for example, can impair blood supply to the optic nerve, making it more vulnerable to damage. Now that we've covered the risk factors, let's talk about the symptoms of glaucoma. The problem is that in the early stages, glaucoma often has no symptoms. That's why regular eye checks are so important. However, there are some signs to watch out for. Gradual loss of peripheral vision. You may notice that it's become harder to see objects on the sides. Difficulty adapting to darkness. If you feel like you're seeing worse in the dark than before, this could be a signal. Halos around light sources. This can be especially noticeable in the evening or at night. Frequent changes in eyeglass prescriptions. If you find yourself changing glasses often due to vision changes, this could also be a sign of glaucoma. Eye pain or headache. This is especially characteristic of an acute angle closure glaucoma attack. Remember, having these symptoms doesn't necessarily mean you have glaucoma, but it's a reason to see an ophthalmologist for a checkup. Now let's talk about how glaucoma is treated. There are three main approaches. Medications. Eye drops and pills help lower intraocular pressure. This is the most common treatment method in the early stages of the disease. Drops can reduce the production of intraocular fluid or improve its outflow. It's important to remember that these medications need to be used regularly, even if you don't feel any symptoms. Laser surgery. Sounds scary, but it's actually a minimally invasive procedure that improves fluid outflow from the eye. There are several types of laser treatment. For example, trabeculoplasty helps improve the outflow of intraocular fluid through the trabecular meshwork, and iridotomy creates a small hole in the iris, which is especially effective for angle closure glaucoma. Traditional surgery. In severe cases, doctors may create new pathways for fluid to drain from the eye. The most common operation is called trabeculectomy. During this procedure, the surgeon creates a new channel for intraocular fluid outflow. In some cases, special drainage implants may be used. Remember that glaucoma treatment is individual. Only an ophthalmologist can select the right therapy for you. Also, glaucoma treatment is usually a lifelong process. Even if symptoms have decreased, you shouldn't stop treatment without consulting your doctor. Now let's talk about glaucoma prevention. While it's not possible to completely prevent development of this disease, there are several steps you can take to reduce the risk. Regular eye exams. This is the most important thing. Starting at age 40, have a comprehensive eye exam every 2 to 4 years. After 65, annually. Know your family history. If you have relatives with glaucoma, be sure to tell your ophthalmologist. Protect your eyes from injury. Wear protective glasses when working with tools or during active sports. Lead a healthy lifestyle. Proper nutrition, physical activity, and quitting smoking are beneficial not only for the eyes, but for the entire body. Control chronic diseases. If you have diabetes or hypertension, monitor your condition and take prescribed medications regularly. Be careful with corticosteroids. If you need long-term treatment with these drugs, discuss possible risks to vision with your doctor. Eat more foods rich in antioxidants. Blueberries, spinach, broccoli, and other dark green vegetables can be beneficial for eye health. Friends, our eye health is no joke. Glaucoma is a serious disease, but with timely detection and proper treatment, you can preserve vision and quality of life. Check your vision regularly, especially if you have risk factors. Early diagnosis and proper treatment can preserve your vision for many years. Remember, your health is in your hands. Be attentive to your body, lead a healthy lifestyle, and don't neglect regular medical checkups. If you liked this video, don't forget to hit the like button and subscribe to the channel. Click the bell icon so you don't miss new episodes about the health of your eyes and your entire body. And now a question for you. Which glaucoma risk factor surprised you the most? Write in the comments. Take care of your vision and see you next time.